Terms related to infection control. Infection prevention, the set of methods practiced in healthcare facilities to prevent and control the spread of disease. Infection, the state resulting from pathogens invading the body and multiplying. Pathogen, microorganism that is capable of causing infection and disease. Localized infection, an infection that is limited to a specific location in the body and has local symptoms. Systematic infection, an infection that travels through the bloodstream and is spread throughout the body, causing general symptoms. Healthcare-associated infection, or HAI, an infection acquired in a healthcare setting during the delivery of medical care. Chain of infection, a way of describing how disease is transmitted from one being to another. Causative agent, a pathogenic microorganism that causes disease. Reservoir, a place where a pathogen lives and multiplies. Portal of exit, any body opening on an infected person that allows pathogens to leave. Mode of transmission, the way a pathogen travels. Direct contact, a way of transmitting pathogens through touching the infected person or his secretions. Indirect contact, a way of transmitting pathogens from touching an object contaminated by the infected person. Portal of entry, any body opening on an uninfected person that allows pathogens to enter. Mucous membranes, the membranes that line body cavities that open to the outside of the body, such as the lining of the mouth, nose, eyes, rectum, and genitals. Susceptible host, an uninfected person who could become sick. Transmission, passage or transfer. Infectious, contagious. Medical asepsis, measures used to reduce and prevent the spread of pathogens. Surgical asepsis, the state of being completely free of all microorganism, also called sterile technique. Standard precautions are measures to follow standard precautions. You wash your hands, you wear gloves, you remove gloves immediately when finished with a procedure, immediately wash skin surfaces that have become contaminated, wear a disposable gown if you come in contact with blood or bodily fluids, wear a mask, goggles, and/or face shields when splashing or spraying of body or body fluids is likely. PPE stands for personal protective equipment, equipment that helps protect employees from serious workplace injuries or illnesses resulting from contact with workplace hazards. Invasive procedures, a procedure that involves inserting a foreign object into a patient's body. Don means to put on, doff means to remove. Transmission-based precautions is a method of infection prevention used when caring for persons who are infected or may be infected with certain infectious diseases. Multi-drug resistant organisms, MDROs, microorganisms, mostly bacteria that are resistant to one or more antimicrobial agents that are commonly used for treatment. Isolate, to keep something separate or by itself. Bloodborne pathogen, microorganisms found in human blood, body fluid, draining wounds, mucous membranes that cause infection and disease to humans. Acquired immunodeficiency syndrome, AIDS, the final stage of HIV infection, in which infections, tumors, and central nervous system symptoms appear due to a weakened immune system that is unable to fight infection. Bloodborne pathogen standard, federal law that requires that healthcare facilities protect employees from bloodborne health hazards. Engineering controls, features incorporated in medical devices that make their use less hazardous. Exposure control plan, a plan designed to eliminate or reduce employee exposure to infectious material. Needle Stick Safety and Prevention Act requires the following of employers: written exposure control plan in place, proper PPE provided, biohazardous containers available, Hep B vaccination provided at no cost, warning labels indicating blood or potentially infectious materials, log of injuries from contaminated sharps, in-service training of bloodborne pathogens, Incident exposure report required for any exposure to potentially infectious materials, test, follow-up, care, and measures to prevent repeated exposure required.